All right, let's get you ready to absolutely nail a classic UKMLA station. We're talking about the GAD consultation.
Welcome to this clinical walkthrough on a generalized anxiety disorder case for UKMLA, brought to you by Medi8, your 24/7 practice partner.
Okay, let's dive right in. Picture this. You're standing outside the door in your UKMLA exam. It's a GP surgery setting. Before you even walk in, you've got to have the scene set in your mind. So, here's the deal. You are the FY2 doctor for this station. Your patient is a woman, probably around 28 to 32 years old, and she comes right out with it. I've been feeling very anxious lately, and it's affecting my work. Right away, that's your cue. You've got a psychological complaint and a real-world impact to explore.
The timer starts. You walk in. Those first few seconds are absolutely critical for setting the tone and building that rapport. So, what are you going to say?
Here's your golden opening. Hello, I'm Dr. Your Name, one of the doctors here today. Could I confirm your full name and age, please? Simple, professional, perfect. Then once that's sorted, a nice open question. How can I help you today? This hands the floor over to her, letting her tell her story in her own words.
Anxious is a huge word, right? Your job now is to be a detective. You need to unpack that one word and find out exactly what it means for her.
So you'll want to use some great open-ended questions. Things like, can you tell me more about how you've been feeling? Or how long has this been going on? And a big one, is the anxiety constant or does it come and go? You see, you're building a picture here, the timeline, the pattern. This is the foundation of your entire consultation.
Okay, you've opened up the conversation. Now it's time to get into the nitty-gritty of the diagnosis. We're going to systematically screen for the key features of generalized anxiety disorder, or GAD.
Think of this as your GAD checklist. You need to take these boxes in your head. Ask about difficulty controlling worry. Ask if she feels nervous or on edge. What about fatigue? Sleep? Don't forget the physical side, like muscle tension or changes in concentration. You have to hit all these points to confidently build your case for GAD.
Great, you've screened for GAD, but you can't stop there. Anxiety is often part of a bigger picture. So now we have to screen for other conditions to rule them out. And top of that list, depression.
And here's a pro tip for the exam: signposting. You don't just jump from anxiety to depression, you explain why you're doing it. Saying something like, sometimes anxiety can come along with low mood. Can I ask a few more questions just to rule that out? Makes the consultation feel smooth and logical, not like a random list of questions.
Be direct with these. Ask the 2 core depression questions, feeling low and losing interest in things. Then you must ask about self-harm. It's a critical safety question. After that, quick checks for panic disorder, PTSD, and OCD. In this scenario, she'll say no to these, which is great. It helps you zero in on GAD.
You can practice this exact case right now. Get objective feedback on mymediate.com.
Right, we've done the deep dive on the anxiety and differentials. Now we need to zoom out and get the full 360-degree view of the patient. It's time to complete the history.
Here's your structure. You're going to run through PMAHTOSA, past history, meds, allergies, family, and social history. You also need to dig deeper into how this is affecting her life, her work, her friendships, recheck the risk assessment, and then the all-important ICE, ideas, concerns, and expectations. What does she think is going on? What worries her most? And what does she hope to get out of this appointment? Her answers here will shape your entire management plan.
So you've gathered all the pieces of the puzzle. The next big step is putting it all together, explaining what you think is happening, and then creating a plan with her.
This is how you do it. You don't just drop a diagnosis on her. First, you summarize what she's told you. Say something like, based on what you've described, the constant worry, the tension, the trouble with concentration and sleep, you see, you're showing her you listened. Then you say, this fits a condition called generalized anxiety disorder, or GAD. It makes the diagnosis a logical conclusion, not a surprise.
Explaining GAD without medical jargon is key. An analogy works wonders. You could say it's like her brain's alarm system is stuck on high alert. And this next part is so important. You have to tell her it's a medical condition, not a personal failing or weakness. This helps to lift so much of the stigma she might be feeling.
When it comes to management, think in steps. We always start with the least invasive options first. You're going to present a clear, stepped care plan. This shows a logical approach, and in this case, it lines up with what the patient wants, to try things other than medication first.
Step 1 is all about self-help and lifestyle.
Give her concrete things she can start doing today. We're talking about offering a GAD leaflet, pointing her to the NHS website, and encouraging daily exercise. Talk about sleep hygiene, maybe suggest some mindfulness apps, and of course, advise her to cut back on things like caffeine and alcohol, which can make anxiety worse.
All right, step 2, psychological therapy. You need to be super clear here. Cognitive behavioral therapy, or CBT, is the first-line treatment for GAD. Tell her you're going to refer her to NHS talking therapies and give her a quick idea of what it is. Basically, it's about learning practical tools to manage worry and anxious thoughts.
Now, this table is more for you. It's a quick cheat sheet to keep GAD, mild depression, and work stress separate in your mind. The key thing with GAD is that feeling of constant excessive worry, the what-if thinking that doesn't go away even when you're supposed to be relaxing. That's different from the hopelessness of depression or work stress that gets better on the weekend. Knowing this helps you lock in your diagnosis.
And we're almost at the end of the consultation. But you cannot finish without safety netting. It's an absolute must. You have to give her clear instructions, something like, please contact us sooner if you feel overwhelmed, your sleep gets worse, or you start feeling low. Help is always available, and we can adjust the plan anytime. This empowers her and keeps her safe.
Okay, that's the walkthrough. You can practice this exact case now on mymediate.com. You can actually go through all these steps yourself, get timed, and see how you did. It's the best way to get ready. Good luck!